Good evening, everyone. I'm Dr. Huda Wahba. I'm here on behalf of Ain Shams University. I would like to thank the team from RRK company, and they are our partners in delivering the course for the US LMLE. And we'll be happy to hear from them introductory presentations on what they're offering and the benefits that you'll be getting from this course, the opportunities that you have at the US, and at the same time, we're going to have a session in the end if you have any more questions. Thank you very much, Dr. Hani, and for your team and for the collaboration, and the floor is with you.
Thank you. Thank you, Dr. Awal. Dr. Awal, can you begin, please, the introduction?
Yeah, Dr. Hani.
Yes.
Hello, everyone. Thank you for attending the session with us today. First, I would like to welcome you all. We are very glad and honored to be with you today in this orientation session. First, we'll start with the opening speech with Dr. Hani Ayash. He is the owner and CEO of RRK Worldwide LLC, and he is assistant dean of one of the biggest universities in the US. Dr. Hani, you can start.
Thank you. Assalamu alaikum jamian. Thank you very much for inviting us to attend this meeting. I want to speak Arabic because I know that a lot of the students now speak Arabic. I will try to make it mixed, and we will feel free to talk Arabic or English because I cannot see any students cannot understand Arabic. But please, as you know, if you want to speak English, please raise your hand and we'll change all the settings to Arabic. First of all, I'm honored to be the president of this company. This company is a training company established in 2019, and we are doing many services, comprehensive USMLE services, including USMLE Step 1, 2, and 3. And we have also service for research, which very important. I think we have deficiency in some areas in Egypt in research, and also we will also provide the elective, which will be in person or virtual. So this comprehensive service will take the students from his country to US directly. If he have good USMLE scores, he has research and recommendation letters, and he has recommendation letters also from clinical attachment in US experience. I think this is the best thing he can do because, and also we'll follow up. We'll mentor all our students during the journey from their country to US, what we call path to US. So first of all, I want to introduce my professor, Dr. Muhammad Larbani. He will talk to you today about the USMLE process in US. Dr. Muhammad, please, can you introduce yourself, and then you can go to talk about your talk.
Thank you, Dr. Hani. Assalamu alaikum wa rahmatullah. My name is Muhammad Larbani. I am a former professor of anesthesiology at the Medical College of Wisconsin. Currently, I'm in private practice. I have my own anesthesia group. I was very much involved in medical education and research along the years of my academic performance. I'm glad to join the RRK in order to open some opportunities for medical students who want to pursue their medical career in the US. And I tell them, you are not alone. More than 100,000 medical students and residents sat for one of the USMLE steps last year. So you are not alone in this path. And RRK is here to help you start your journey. Your journey will start by taking the USMLE. It's the United States Medical Licensing Examination. For international medical graduates and people who are still students in accredited medical schools in the US, and medical schools that are written in the word directory of medical schools are always welcome to go through the USMLE if they want to pursue their career in the US. And let me tell you that after when you get this examination done, you will be applying for residency And the match result from last year shows that 57% of international medical graduates matched to their desired position. So there's a big chance once you clear those steps that you get accepted here into a residency program. The United States medical licensing examination is an examination to assess the knowledge, the medical knowledge, whether in basic sciences or clinical sciences, in order to make sure that you are ready to start your medical training here and to start dealing with patients in a supervised manner. In order to deal with patients and treat patients in an unsupervised matter, you will have to take step 3. But let's focus first on step 1 and step 2 in order to get a residency here in the United States. You go through what we call here an educational committee for foreign medical graduates. This was established in 1956, and it gets you a certificate. Once you pass those steps, this certificate is considered like the National Board of Medical Examiners certificate for US and Canadian medical students. So you are equal to those in the chances to get a residency in the United States. You have to go to step 1. Step 1 is assesses your medical knowledge in the basic sciences, the foundation of the clinical applications. And those will include, of course, physiology, pharmacology, anatomy, histology, biochemistry, pathology, microbiology, immunology, and the add-to-add behavioral sciences, aging, nutrition, and biostatistics. Those are the topics that you'll be examined for. Most of those topics you take in your home country and home medical school, but they need sometimes to be polished, they need to be reviewed. And you need to be well prepared to the nature of the course here, because the examination here is a little different than those you might have back home, wherever you are. Usually, U.S. medical students take this test by the end of their second year, and they take step 2, which is clinical knowledge, by the end of their third year of being medical students here in the U.S. The examination is a 1-day examination for step 1. It's an 8-hour examination, 7 blocks. Each block is 60 minutes, and you get 40 questions in each block. The total of questions you are getting will be 280 questions in that single-day examination. You have 60 minutes, from 45 to 60 minutes of breaks in between if you want to go to the bathroom, if you want to give a quick phone call, if you want to have a bite or something like that. It's a tough test, and you got to be well prepared. And regarding step 2, which comes after, it tests your knowledge in the clinical sciences and how you can diagnose and treat patients in the clinical setting, in the hospital or in the surgical center or in the office or wherever you are. So it tests you for your knowledge clinically in internal medicine, obstetrics and gynecology, pediatrics, different surgical subspecialties, and usually some other, like psychiatry and some other clinical topics. It focuses and centers on patient management. So either step 1 or step 2 are usually given in questions, are given in a case scenario. So it starts with 32-year-old adult female came to the ER complaining of pain on the pelvis, and the examination showed, laboratories showed this with high lactate or low pH or whatever, and your most likely next step will be 1, 2, 3, and you choose. It's a multiple choice examination. Step 2 examination, again, is a one-day examination. It's a little longer. It's 9 hours. It's 8 blocks. Each block is 60 minutes, and you get examined in 40 questions in those 60 minutes block, and you have 1 hour break all through the days, from 45 minutes to 1 hour break throughout this day. So you end up with 318 questions that day. If you clear both steps, then your chances are high in getting a residency. You can start applying through the RA system to your residency in the US. And as I said, almost 60%, 57% were matched of international medical graduates. It will make you happy also to hear that 1 of every 4 practicing physician in the United States is a foreign medical grad. So you guys go ahead. You have a promising future waiting ahead of you. I'm glad to be one of the faculty members in RRK who are going to help you start at least this journey. During this course, we are going to help you understand how to prepare. We're going to help you locate the real resources. We're going to give you some resources, literature. We're going to give you lectures and with emphasis on high yield points, which come usually in the exam. We're going to tell you how to apply and register for all the different steps. And I think in Egypt, usually it is the exam is either held in the Amid East in Cairo or something similar in Alexandria. There are 2 sites, Cairo and Alexandria. And you can take it in either place. It's the Prometric test centers back there. And if you are a medical student in an accepted medical school, or you are a medical graduate, then you are eligible to apply for this examination. So good luck to you all. We are going to help you start the journey, and it's a wonderful journey. Best of luck to you. I'm glad to talk to you, and I'll be seeing you during the course. Thank you, Dr. Hani, Ayash, and I also congratulate all the faculty that are attending this introductory meeting, and looking for more collaboration with you guys in the future. Thank you, everyone.
Thank you very much, Dr. Mohammed.
Thank you, Dr. Mohammed.
Thank you.
Next, we have Dr. Dia Hakim. He is Professor of Cardiology, Harvard University, USA. He will give us more details about USMLE and US residency.
Good morning, everyone. Good afternoon in Egypt, everyone. It's my pleasure to be here and see my older professors, my fellows, and everyone from Egypt. Well, my name is Dia Hakim. I'm originally a graduate from South Canada University, and I got my PhD in cardiology from University René Descartes in Paris. Then I joined the U.S. Institute almost 13, 14 years ago, where I worked at Columbia University Medical Center in New York, then Yale University, and now I'm at the cardiology department, Brigham and Women's Hospital, Harvard Medical School, responsible for the intravascular imaging in interventional cardiology. And it's my pleasure to be with you today and to be part of this elegant team. Actually, our dear professor, Dr. Al-Arbani, gave a very, very detailed and nice introduction about the USMLE and the journey, the pathway of the graduate or the students in this system. And as you might know, the USMLE is the United States Medical Licensing Exam that will prepare you to, as Dr. Al-Bani said, to be part of the U.S. health system. So as I said always before, we have to divide it into 3 steps: the test, the USMLE test, then the matching, then the residency program. And I think in the RRK, we will help you to understand and to deal with these steps. And again, as Dr. Al-Arbani said, you have to register first in the site of the ECFMG, So like the first step will be registration in the site. You have to create an account. That's I bet many of you might know this details because it's you can find it everywhere in the site of ECFMG and everywhere. But this is just to remind you. As I said, it's just a general introduction, and then we might take you in a specific sessions after in details. So the first step will be to register. The first step will be to register in the site of ECFMG to get an account and password. That will be your account and your ID number for everything from the beginning of the procedure till the end. So this number is very important, and it will be some lengthy process to confirm your documentation and your registration, and you pay for the fees of the exam. And then from this point, once you are registered officially in the ECFMG site, at this moment you can register anytime with this ID, and you access your account. Your account will be like the account to handle everything, to handle the documents, the test results, the score, and to pay for your different steps. Each step has a different fees. It's changeable. It can be changed from one year to the other, and so on. Now, as Dr. Bani said, we have the test is actually step 1, step 2, and step 3. And before the pandemic, step 2 was 2 steps, step 2 CK and step 2 CS. The CK is the clinical knowledge, and the CS was clinical skills, which was an exam to deal with simulating patients. But now, after the pandemic, they changed this with like a test, like an English language test, and the way it was transferred to this test. And you have to go after. Let me return back to the process of the process of registration. After you register, you have to schedule for the exam. You pick a schedule window for the exam, or a period for the exam, which is usually 3 months period, and you can extend this period if you're not ready with the fees of extension fees, or if you're not ready at all and you missed like 2 extension, or you did 2 extensions, you are not allowed to extend more. At this moment, you will lose your money. So you have to be sure that to pick a period or a window eligibility period at which you will be at least ready to pass the test. Take care of this. This is a very important point. Don't pick an eligibility period after 3 months while you're still not ready. So you need to extend, and then you are not ready, and then you will lose the money. So it's very important to pick an eligibility period that will give you some time to prepare. And again, this will be also a help from the company to help you to follow your curve, your learning curve. If you're ready or not, are you 70% ready, 80% ready? What's the possible score you might achieve? So that's an important point. The second important point will be your resources, and there are different resources: the AMBUS, the lectures, the materials will given you from the company that will help you, and of course will be the feedback, the questions, and the answers during this lectures or during the seminars in the course. It's very. I will not repeat what our dear professors say about the contents of each step, but the most important is whether it is step 1 or step 2. You have to change your way of thinking. Again, I will repeat this. There is a statistics or say that, and an article say that the USMLE exam is neither reliable nor valid, neither valid nor reliable. It means that the test is unpredicted. The results the score is unpredicted. you might have knowledge, but you will fail. You might have not the knowledge you're expecting and you pass. So it's not only about the knowledge, but also how you can use this knowledge to answer the question. And this is what you need help for, actually, especially for someone who had an experience before or who understand the system. For example, like as I said that before, it's here in the U.S. health system. There is a Medicare, Medicaid system. It's a system of medical insurance for old people or people who doesn't have resources. So you might have some questions like that. This situation you didn't face in Egypt. You might have some restrictions in practice in the form of questions. Of course, someone has a Jehovah Witness with people refusing blood transfusion, people having some medical legal. What you're going to do, how you can break a bad news, all these things. What you're going to do when you are facing a patient with terminal illness or with cancer. So it's not only the knowledge. It's not only that you know that the treatment of cancer breast is so and so and so, but like it's important to know how to use this knowledge to pass the test. Because the aim, as I said, this test is it's not neither valid nor reliable, but it's the only way. It's the only way to go in the system to be licensed and to practice. So that's the first point. You know that you need to get the knowledge, the maximum knowledge you can, and also how to use this knowledge. The test is in the form, as Dr. Arbani said, this is in the form of a problem. It's a problem-based exam, and so you have to be very quick in scanning the question, this problem, and to pick the most important point that you will focus on or concentrate on to get the best answer in 50 seconds. So you have, like, for each test, if we think that the block of questions is 40 questions, so you have in 1 hour, so you have between 50 seconds and 1 minute to scan the test and pick the best answer. Sometimes you don't know the answer or you are hesitating which one. So also we will work with you to overcome this problem. What if you don't know the question? What is the best guess, and how can you answer the question with the success? So this should be applied for step 1 and step 2, with the difference in the material or the contents of step 1 and step 2. Step 1 is basic science. Step 2 is clinical knowledge. And again, the score is very important. The more you are answering the question, the more you do the Q banks, the more you will get. You will get a higher score. And in the RRK, there is like a big team of experienced people who passed the test, who were working with the students before, and the most important will be like people who are working in the American system and know how you can approach the question, because this is the most important. The most important is how can you pass the test by using the knowledge to answer the question. Will help you to overcome these difficulties. The second step will be after passing the test and getting the score, is to match. Matching is the transitional step between the test and having residency. So because like passing the test, it doesn't mean a lot, but using the test to match will be the second step. And the matching process is a difficult process, because you have to go in a competition with the other students, the graduates. Not only students from US, but students from all over the world who are applied for the matching. The matching process will depends, of course, from one program to the other, but like the overall criteria will be based on your score in the USMLE test, and also recommendation letters. Very important for someone to give you a recommendation letters, and mainly, well, I can't take it to the level even of personal recommendation. Some phone calls or direct contact with the program director. That's a very important step in having getting matched. The third step will be, or the third important elements for matching will be if you did some research or did some publication that will help you to submit a powerful application, and also if you did any clinical attachment or elective, that it means that you have been exposed to the clinical experience in US, and the company will help you in this. So this is the second step, matching. Matching, as I said, it's a difficult process, but also if you'll be well prepared, if you work to get a good score and a good recommendation letter and some research, that will increase your possibility to get matched. And as Dr. Arbani said, almost 50% of the matched people last year were foreign graduates. It doesn't mean that the American graduates are not good. It just means that it's the system which is balanced between the foreign graduates and the U.S. graduates.
Continue, Dr. Dia. Sorry. Yeah.
I guess, Dr. Hoda, you muted everyone, including Dr. Dia.
Please, can you mute just the audience? Dr. Hoda?
Dr. Dia, could you unmute yourself, please?
Yeah, I'm sorry. So as Dr. Muhammad said, the step 3 is an important step, a complementary step to get the to get your license. So like most of the states require the 3 steps to get the permanent license to practice. So this will be during the residency, and I'll return back to the point of matching. After you matching means that you will get a residency. And in US, you can't do most of the specialties without having a general residency. So if you like to do cardiology, or if you like to do a GI specialty, you have to do internal medicine first. If you like to do specialized surgery, you have to do general surgery first. It depends. It's different from one program to the other, but in general, internal medicine residency is 3 years, and the general surgery usually 5 years. And then after, you can be specialized. You can do a fellowship, and this fellowship will be your specialty, the specialty you pick. So this is. The steps in sequence like that will be preparation for the USMLE test, passing the test, and then applying for the residency via the ERAS system, which is the system for application, and will inform you about matching. The more you apply, the more the programs you will apply for, the more the chance to get invitations. So then you will get into invitations for interviews in 5, 6, 7 programs, and then you will go for this invitations like for interviews, and then hopefully you will get matched. So there are in this pathway to work in US, to practice in US, there are 3 steps. Each of them is like actually is depending on the previous steps. So you need to pass the test to get the ECFMG certificate, which is the certificate that it says just you are equal to the US graduate. Your MD degree is equal to the students from graduated from a US university, or valid to have a residency. And then it's going to be the second step will be matching. You'll apply for the for the matching process based on your test results and the previous elements I said. And then the third step will be to be hopefully to get matched in one of the residency programs, and you pass the residency, then you'll be full licensed after, whether you decide to work as a general practitioner or an internal medicine doctor or general surgery, or you continue doing the fellowship, which is a specialized program. And in RRK, as Dr. Hani and Dr. Muhammad said, we will work with you in each of this steps to help you to and to guide you, hopefully, to reach to the end of this journey. The benefits and the benefits, I think, all of you know the benefits of practicing. If you like to continue in US, if you like to return back to Egypt, if you like to go work somewhere else, I think that will be a very good experience for you. It's going to be beneficial for you, whether you decided to continue in US or you decided to return back to Egypt or to go to any other countries, depending on your your aims and goals. Well, that's just a brief description, and I'm sure that we will have more sessions to explain those elements in details. I'll be happy to answer any question and get any. If anyone has any question, I'll be happy to answer. Thank you so much.
Thank you so much, Dr. Dia. Next, we have Dr. Yasser Adman. He is board certified, University of Texas, USA. He will tell us about his journey to becoming US physician.
Assalamu alaikum. Hello, everybody. It's morning here, so good morning to everybody. I think Dr. Dia Hakim has really made my job very easy, because he has explained extensively a lot of things that I would have presented, but he has really done a great job explaining the whole process. I'm just gonna briefly talk about myself. I've been in the American system, health system, for the last 18 years. And as Dr. Dia has said, I started with internal medicine residency, and I specialized in pulmonary and critical care medicine. Definitely getting into the American health system is a process. It's a challenge. It's a different story from person to person. That's why what I tell everybody is everybody has a different story. There's nothing impossible. I have seen so many different things done different ways. Definitely, the better the CV regarding research, hands-on experience would make a big difference in getting into the competitive, as the journey is getting more competitive, to be a part of the system here. But it is doable, and with hard work, I think it's could be there. The more research you do, the more hands-on experience, the more presentable your CV is. And I will be happy to answer any specific questions. But as I think Dr. Hoda has wanted to, I can explain what I've done. I honestly started with doing research in critical care medicine in 2004, University of Pittsburgh, and it was just persistence. You have to send people emails, check what programs are available, and dig your chance on your own. And I got research really helped a lot in getting into residency and into getting into be part of the system here. The other thing, what we can offer in RRK is also giving you the experience that we've been through, how to make it easier getting to match in residency, how to understand the system from inside, and answering any questions that you might have along your journey. And I will be happy to answer any questions from what I know about the system. If there any anybody has any questions, I'm happy to answer. So I will stop here.
Thank you very much, Dr. Yasser.
Thank you, Dr. Yasser. Next, we have Yusuf Tanas, who got the highest USMLE Step 1 score in the world of 277. Also, Yumna Isam, also one of the highest scored students. They will tell you more about how to prepare for USMLE exams.
Hello, everybody. It's first of all, it's great to be here and it's an honor. My name is Yumna. I'm a fifth year med student at Alexandria University, and today with me I have Yusuf. He's a friend of mine. We both are fifth year students, and last November we both sat this USMLE Step 1 exam, and 2 weeks later Yusuf received his results and he managed to score 277, which is the highest score in the world so far for the USMLE Step 1. Which, of course, it's like it was like the best news ever. And today we're here with you because we want to share like our experience and we want to correct some misconceptions. So, Yusuf, you go ahead.
All right, thank you so much for the intro. So I'd like to begin with clearing up a few common misconceptions among medical students, especially in Egypt. And the most important one being passive learning. So, or using resources that are basically passive learning resources like reading huge textbooks or just going straight to first aid or watching long videos from lecture series like Kaplan or whatever company out there. We personally think that this method of studying is inefficient and ineffective, considering the fact that the focus of the exam and the questions of the exam are based on application of knowledge and critical thinking, like Dr. Dia emphasized. And so we'd always recommend starting questions as soon as possible, even if your foundation or your base is weak and it's not good enough to understand complex questions, because the point of question banks is not only to get a picture of the real exam questions, but to also learn. That's why they have explanations for every answer choice. So we'd recommend that people start with questions as soon as they can, because it's also an active form of learning. And so it helps when you answer questions and think critically or reason yourself through the answer choices. It makes things stick in more, and also makes you get a feel of the real exam. And also there are studies out there that have shown a positive correlation between the number of questions that you solve and your Step 1 score. So it's not only a personal experience, it's actually proven that it's the most effective way to study. So yeah, and Yumna, I wanted you to talk about how we approached questions and the note-taking part. What do you think of note-taking and all this stuff?
Yeah, so basically, I want to say that like every student, when we started, unfortunately, we started doing the wrong thing because nobody was there to guide us, and hopefully, like this won't happen with any of you, because we want you to avoid all the mistakes that we have done. So the first thing that we did when we started solving questions, you're just like, okay, new information, let's take notes. So, and that was such a waste of time. Like it's a terrible idea, and it's very common in here. Like each questions have a notebook right next to you, and you keep writing this stuff. It doesn't help. Like you could do that, it will take so much time, and it will it won't allow you to solve more questions. And at the end of the day, you feel like exactly, yeah. So Yusuf would always go like, okay, let's just read the educational objectives. That's enough. We don't need to read anything else. So and honestly, at the beginning I was just like, no, Yusuf, let's not. We can't do that. We have to take our notes and stuff. And honestly, like the most of the students I've met, they don't go back to their notes, because at the end of the day they go like, oh, we have so many questions we want to do. There's no time to review those notes. So it like you always say, like it's concepts repeat. So if it's a high yield topic, like you'll see this concept many times. So you don't need to worry about writing it down and going back to it again. It's very ineffective way to do this.
Exactly, and also it ends up becoming a passive form of learning, and it takes up time from solving other questions. For example, if it takes you 2 hours or 3 hours to write notes for a block of 40 questions, you could have spent this time solving another 100 questions and actively learning and reasoning through those questions. So it also takes up time for more important stuff. And this is why at RRK there will be question sessions on a weekly basis to teach students how to approach questions and critically think, because of course the questions are not exactly the same style as we have at our uni or at universities in Egypt in general, and especially for step 2, the question stems are really long. They could sometimes be half a page, and you only have, like Dr. Dia mentioned, you only have like a minute and a half for each question, and you have like a minute to read the entire thing and carefully analyze it, and then another like 30 seconds to think of the correct answer. And so yeah, you have to be quick at this, and it needs a lot of practice.
Yeah, that's correct. And like Yusuf, one more thing, like people like to do like the same Q-bank, they like to repeat it over and over again. What do you think about that?
Oh yeah, I think we think that this is not a good idea, especially when I hear a lot of people go like, oh, UWorld is the gold standard, let me do it 2 times, 3 times. I even hear people say 4 times. So I think this is crazy. It's much better if you're seeing new questions and thinking critically the entire process from the beginning, because when you're in the real exam, you're not going to see questions verbatim on the real deal. Yes, the concepts do repeat, but you're going to have to think critically and apply the knowledge that you have into novel clinical scenarios, not the questions that you've seen multiple times verbatim. So it's better to get used to answering new questions, and even if it's something that you don't know. I mean, we both started with low percentages, but this was actually a good thing when we started question banks as soon as possible, because it helped us learn how to apply the basic knowledge we have into complex scenarios, and that's what we needed to get a high score on the real exam.
Yeah, and like one last thing, because like I would just want to add that when we started doing questions and focusing on questions, and of course we try to learn the material and absorb it, it's solving the questions that actually progressively increased our scores, and that's true for almost every single person. So at RRK, we always focus like that. Our lectures would be very concise, very exam oriented, and that we have a subscription to Ambos. Each student will get, once they subscribe to the course, so that they could from day one start solving questions. And like Yusuf mentioned, we would have like weekly question sessions, and we discuss with the students how to approach the questions, and like those are top priority at RRK, because those are the things that allowed us to get the highest possible score that we could get. And I just want to say that I always say that, like throughout the dedicated, Yusuf like would always like try to monitor his score, and you go like, oh, I started at start 260 or something like that, 265 in dedicated, not like so. And then at the end he just like ended up making one mistake, and then he got 279 in MBME 30. So, and that's like so, yeah.
Yeah, exactly. So So yeah, we're glad that we're gonna have those sessions at RRK. Hopefully, this is something that will benefit students as because of personal experience and studies out there. It's been proven, and I think we covered all the important points, Yamna, right?
Yeah,
I think that
so.
sums it up. Yeah. So
Thanks,
thank you
boss.
everyone for listening.
Thank you.
Thank you, Yusuf and Yumna.
Thank you, Yusuf
Thank
and
you.
Yumna.
Thank you so
Thank
much.
you. You did a
Thank you.
great job. Thank you. Yusuf and Yumna working with us also. So, and we are proud of them. All their experience will be in RRK, and we are honored to have them. And I think they have a very beautiful future with us. Thank you.
Thank you so much, Dr. Hani. We really appreciate it.
Thank you.
Doctor.
Thank you, Yusuf and Yumna. Now we have Professor Gary Neiman. He's Director of Transitional Critical Care Lab in Upstate University, USA, Department of Surgery. He will talk about the importance of research lab and how to be involved.
Thank you very much for that introduction. And I would like to thank RRK Worldwide for inviting me here to overview the research that I am conducting in my laboratory in Syracuse, New York. As an introduction, my name is Gary Neiman. I'm a professor of research in the Department of Surgery at Upstate Medical University in Syracuse, New York. And I've been there for 46 years. I'm the director of a translational large animal laboratory. And we study the pathophysiology and treatment of the acute respiratory distress syndrome, ARDS, and also multiple organ dysfunction syndrome, MODS or MODS. I've won major teaching and research awards given out by the State University of New York, of which Upstate Medical University is a member. And last year I won the Forrest Bird Lifetime Achievement Award for my work in the field of respiratory physiology. So why is a translational animal lab important to clinical research? Because it simulates all of the components of a patient's disease that we try to study. In our case, we simulate a patient that is developing MODS and ARDS. Therefore, if you have a excellent translational animal lab model, any treatment that you find effective in this animal model will quite likely translate to a positive human clinical trial. Currently, our laboratory has 3 translational models. The first is a 48-hour sepsis and gut ischemia reperfusion model that develops both MODS, MODS, and ARDS. As you know, sepsis is a key mechanism that causes ARDS and MODS in the clinic. The 48-hour duration mimics the amount of time that it takes for the syndromes to develop. We simulate the ICU in that we use critical care grade mechanical ventilators, fluid resuscitation, antibiotics, and we measure all of the lung function and hemodynamic parameters that you would measure in the ICU, in addition to clinical blood gases and chemistry such as CBC differential, liver enzymes, coagulation panels, etc. So essentially what we have an intensive care unit as a laboratory. The second model that we've developed is a heterogeneous surfactant deactivation ARDS model to study role of protective mechanical ventilation on both normal lung tissue and acutely injured tissue. And why did we develop this model? It's because, as you know, ARDS causes heterogeneous injury. So you have acutely injured tissue directly adjacent to normal tissue, and you have to find out if your protective ventilation strategy protects just the normal tissue, just the acutely injured tissue, both tissues, or neither tissue. And lastly, we have a piglet model in which we deliver by C-section to study neonatal and pediatric ARDS. If we deliver the piglets early, prematurely, then we can study infant respiratory distress syndrome. If we deliver the piglets at term, we can study pediatric diseases such as meconium aspiration. So what are my current research efforts in the laboratory? Far and away, the thing we study most is protective mechanical ventilation for the ARDS patient. We've developed a time-controlled adaptive ventilation strategy called TCAV, TCAV, which is used to set and adjust the airway pressure release ventilation, APRV mode. And we found it to be highly lung protective. The TCAV method is personalized to the patient's lung pathology and adaptive as the patient's lung gets better or worse. We have shown that TCAV rapidly stabilizes the acutely injured lung and then gradually opens it over several hours or days. The TCAV method has been shown to reduce the incidence, morbidity, and mortality associated with ARDS in our translational animal models and in the clinical meta-analysis. We currently are going to offer a one-day TCAV course covering both the physiologic mechanisms of TCAV and clinical application of it in the ARDS patient, and this will be offered through RRK Worldwide. The second project, which we've just become involved with, we're studying a novel chemically modified tetracycline, CMT3, to prevent and treat both ARDS and MODS. CMT3 is a pleiotropic anti-inflammatory drug that our group has modified using nanotechnology to be delivered into the lung via aerosol. Although our main focus in the lab is research, we have a very active, we are also a very active teaching laboratory. I take, for the last 20 years, I have had surgical residents from our department spend between 1 and 3 years in the laboratory. The surgical residents conduct experiments that I have funded through my NIH and Department of Defense grants with the help of 2 technicians. Over the years, the residents in the lab have published many papers in high-powered journals, have presented many abstracts that have won research awards from major international meetings. In the summer, we also take on 2 medical students. Many of the medical students have also successfully conducted small studies that I give them, which have resulted in multiple abstracts being presented at major international conferences, and many of these students have won student research awards. Some of the students have actually published their summer work in high-powered medical journals. And lastly, we also take in undergraduate and even high school students. Many of the students most of the students just observe the experiments that we're conducting, although several of the students have conducted very small studies and have presented abstracts at local and regional conferences. One of our high school students actually won a $20,000 scholarship to Syracuse University for a study that we mentored. With that, I'd like to thank you for your attention, and please address all inquiries as to collaborating with our research group to RRK Worldwide. Thank you.
Thank you, Prof. Gary. Thank you very much.
Thank you, Professor Gary. Now we have Dr. Hani will give you an introduction to what our services are and who our team is.
Thank you very much, Dr. Ola. So, as I told you before, thank you very much. And we are honored to be with you here in RRK. We are an American medical education company, as you said, established in 2019, specialized in medical education, training, research, and simulation. I am honored to be the president of this unit of this company. I am MD, PhD. I'm assistant dean of one of the medical academic universities in the US. I'm assistant professor also in internal medicine department, surgery, critical care research department, and neurology and cardiovascular perfusion. We are honored. We have elegant team, really. Some of them you will see today, and some of them they cannot attend, but we have elegant team, including board-certified medical doctors, professors, USMLE holders, and we have students also. But we have the highest student, we have highest graduate student with the high grades all over the world, is Yusuf and Yumna. Thank you. This is our team in many specialties. We have team for teaching. We have 2 groups for teaching, English teaching and Arabic teaching mixed. We have also a research group, which our professors in research, this is great chance that they are working with us. And we have also Jafar, he's the director of operation manager of the research. We have also Prof. Gary Neiman, also he talked about himself. We have Dr. Wiseman, who will talk to us now about all the American or the English version of this USMLE step 1, 2, 3, and also the electives. And we have a lot of other qualified training and educated physicians from Egypt and from US. This is what we call the road to US with RRK. First of all, you know that the US graduate medical education, I will try not to repeat what's said, but as Dr. Dia and Dr. Irbani and Dr. Yasser and all our colleagues said, that the US graduate or international medical graduates applied to GME position in September and the result in March. They will begin training in July. They will have GME position. Residency training in general specialty lasts from 3 to 5 years. But if you want to be involved in fellowship training in subspecialty, it will take from 2 to 3 years after residency. Graduates of US GME are regular to sit for the American board specialties and subspecialty, the highest medical degree all over the world. What the requirement to be resident in US? So the graduation from medical school listed in the World Directory of Medical Schools before 2024, or medical school accredited by World Federation for Medical Education. Number one. Number two is ACFMG, Educational Commission for Foreign Medical Graduate Certificate equivalent US graduate. You must have USMLE Step 1, which is not, it's pass or failed after January 26. So it's a great choice for you now. You'll not focus a lot on Step 1. Step 2 exam and the OET, which is occupational English test, language, and then you can take optional Step 3. The fellowship, the same, plus finishing residency at US or worldwide. What USMLE Step 1? As we said before, it can be taken by medical students of the second year or medical graduate, available weekly in all the country worldwide in prometric centers. Scoring is pass or failed. Basic science in clinical format, mixed questions. It's 7 blocks by 40 questions. Blocks, it's 280, as our professor, Dr. Muhammad Arbani said. USMLE 2 can be taking medical students, same, available weekly, and score the exam. Score here matter a lot. And you must have clinical science and 8 blocks by 40 questions, about 320 questions. OET can be taken anytime, available all year worldwide, English language exam, but medical, not like IELTS. It will focus on the 4 parts, writing, speaking, reading, and listening. The score B is required. USMLE 3, which is optional, which only available in US, prometric, 2 days exam, first day 6 blocks by 38 questions, about 230 questions, and the second block also about 180 questions, plus 13 case simulation. Scored exam required to apply for fellowship, not required to apply for residency advantage if you have it. What the cost of the total cost of the ECFMG certification expenses, application, as you said, 150. Step 1 about the application will be 1,155. Step 2, 155. Also OT about 455. Final application 900. Total will be $3,815 US. Here, the National Residency Matching Program, 2019. As Dr. Muhammad said, they request for the first year residency position offered about in 2020, it was 34,000, and in 2021 it was 35,000. And the IMG, which is International Medical Graduates, they win about 12,000 from them from 2020 and 13,000 from 2021. And the matching, as Dr. Muhammad said, also 2020, 61% with IMG matched. In 2021, about 57 of IMG matched. This is great, of course, for the international non-citizen students. Here, the US students in 2021, so it's about 40% didn't match versus 45% from non-US citizens. And matched about 59 versus 54. This is great to be matched. And this is the residency, how much position, how many positions it's offered, and what the field, all of them. And also the IMG have great percentage of all the residency. This is a foreign trained position in US now. As you said, 2021, 57%. You know, now it's a great chance for foreign students to apply for the residency because there is a lot, as Dr. Muhammad said. What the life during residency? If you became a resident, the most advanced medical training and education all over the world. The salary will be around from $3,000 to $4,000 per month after taxes. Human hours about 80 hours per week. Opportunity for teachings, research, and clinical work. What the life after training? Life after training, I think this will, all of you, this is your target because you will have board certified, the most reputable medical certificate all over the world. 3 main pathways, as Dr. Dia said. Work in private practice here, which average yearly salary from $200,000 to $700,000. Work in academia or leave US and work wherever the world, and you will have the highest salary all over the world. Or you can apply for the green card because now we need you. The country will need you because you are a professional worker now, and we need doctors, especially in pandemics. And this pandemic, the factor increasing the chance. So what the factor will make you eligible or fit for this matching without waiting all of this time? Number one, year of graduation. If you are younger, it will be good, but we can help you also in RRK to do this. Clinical experience, US and foreign. RRK can help also. USMLE scores, RRK can help because we have now a program. It's integrated program, USMLE 1 and 2. You can go to take the test of USMLE step 1 now, and you can, after 2 weeks, you can go to step 2. So we will save your time because, as you know, USMLE step 1 and 2, there is mixed or there is overlap about 60 to 80% of the science. So this is our job. We'll do it. Research experience. We have a very good history of research in RRK. All our team publishing a lot. We have in the highest impact factor journal all over the world, like Lancet. We published last year about 3 papers in Lancet, and the PMG, and a lot of them. And Prof. Neiman also, I published with him with the Blue Book, with #1 all over the world in critical care and other stuff. So we will involve you in the research in detail, and I think Jafar, and we'll talk about it now. ERAS, electronic residence application, service application. I will help you how to do this and to write your personal statement. Letter of recommendation. This is the most important because if you want to letter of recommendation from the American experience, it's very difficult to take it from when you are in Egypt. And this is very important to you when you come to US. And this is why there is a lot of professors, a lot of American experienced doctors here in our company, because if you are great and you did the achievement, we can write the recommendation letter. So, and if you have this one, the USMLE in good grades and also research and the recommendation letter and clinical experience in US, so you have all the requirement to go to the match very easily. And also, when you go to the interview, we'll help you. Also, we have some people who will help you to train you how to go to the interviews. RRK service, USMLE preparation programs, USC clinical experience, and Dr. Weissman will talk about it now. Observation, medical electives, placement, and getting letter of recommendation through it. This is very important. Medical research and biostatistic course. We have a very strong biostatistic course. And also we will involve you in small groups for research. And at the end of these 2 years with us, or 18 months, mostly you will have, if you are interested, you'll have 2 research if you join our research program. Research opportunity and guidance for publication, and ERAS and personal statement editing, match interview practice. Our USMLE course, about 1 to 2 years, comprehensive program for the second year medical students, experienced US university faculty, professors, residents, USMLE holder, and the ECFMG certified physician are our instructor. This is very difficult to find all of this brilliant or elegant team in one course. And this is why we said RRK can help you a lot, because it will be comprehensive service through all the aspects. Our USMLE course, updated lectures according to the latest USMLE curriculum, question solving and practice through our course, subscription to Ampus Question. We have partnership with Ampus, and we will give you free basic package during your journey with us. Follow up till the exam day, US clinical experience, letter of recommendation, research, all what you want here to apply for the matching. We will take you from home to your matching. This is what we will do, the comprehensive services for you. Our extra services is US professors. Very difficult to find these elegant people in one program. Research opportunity publication, and this will be once you finish the course. If you're interested in research and you join our research group, you will publish papers with us in international journals. Letter of support from US professor, Ampus USMLE tools, virtual and personal elective. Dr. Wiseman will talk about it now. Our partnership, we have training under and postgraduate American societies and university education, research and clinical application with MDs or health professional. And also we have collaboration. We are honored to have collaboration with Ain Shams University, which is one of the largest universities all over the Middle East. And we are honored to have this establishment of this partnership. And we are honored to give our service to all the people in Egypt, all the people all over the world, not in Egypt only, all over the world, to work with us or to train them to go to their journey and achieve their dreams of becoming a U.S. doctor and practice medicine in U.S. Thank you very much for your time, and I will thank you, Dr. Awala. You can go to the next step.
Okay, thank you, Dr. Hani. Now we have Dr. Wiseman. He is IM Internal Medicine Board Certified, New Jersey, USA. He's also the instructor of our English course in RRK. He will tell you more details about our integrated Step 1 and 2 course, Step 3 course, and our electives.
Hello, and thank you, everybody. Thank you, Professor Aish, for involving me and allowing me to attend today, and thank you, Ain Shams University, for this collaboration and for allowing us to have an opportunity to get our a little bit more about our company and kind of what we do here at RRK Worldwide. I sort of wanted to start off just a quick introduction about myself. I'm from New Jersey, born and bred in New Jersey. I did all my education here in New York City, which is only a few minutes, if you know the geography, only a couple of minutes from New Jersey. I did my undergraduate, I did my medical school in New York, and then I finished my residency in internal medicine. I'm currently a chief medical resident in one of the largest healthcare systems in New Jersey. And what I've been doing is I've been educating medical students through our US medical school system for about half a decade now, both clinical and basic sciences. And with RRK Worldwide, we offer this very, very unique combination course. And my responsibilities are helping with the Step 1, Step 2, and Step 3, USMLE Step 1, 2, and 3 review courses. So I'll first talk about these courses, and then I'm going to go on to talk a little bit about our externship, our US clinical experience, which is obviously super, super important. So in summary, the USMLE Step 1 and Step 2 CK course is very, very unique. And I'll start off by saying what we don't do. What we don't do is give long, dry lectures about topics in medicine, surgery, and OBGYN. We aren't there to teach content in mass lectures, because as we spoke about before, that is really futile. It's a waste of time. What we do is we review and teach the high yield topics in every single topic that will be in Step 1, Step 2, and Step 3. And then we really aim to do a question-based approach. So every single topic we teach in the high yield, we just go through, we don't go through questions in the form of questions. I speak out in the lectures and the videos exactly where they will ask you. They'll ask you on this, they'll ask you on this, they'll ask you this way, they'll ask you that way. And our aim here is that when you sit down to take the exam, all of these will play back in your head and you'll really get into the mindset of thinking like the exam writer. It's taking the content and answering the question, getting the question right. We don't care to talk about, for example, we're talking about myocardial infarction, and I have a PowerPoint, that's going to be coming up right now, and I'll tell you exactly how we're going to teach this course. But we're not here to talk to you about the pathophysiology and the risk factors and lifestyle modifications. And you could take this topic and listen for a 3-hour lecture, which is great. It's educational, but that's not how you answer the questions right on the exam. The way you answer the questions right on the exam is going through actually how they will ask you the question and nailing the right answer and saying, okay, these answers are wrong for these reasons. That's the only way to do it. And how do we know this? Because myself and the colleagues who are going to be giving these courses, we write questions for, we write content for first aid. We wrote questions for the for AMBOSS. We wrote questions for Kaplan. So we know exactly how this stuff is done. And even some of us have suggested questions for the actual USMLE, but a lot of that's confidential. We can't talk about that, but we know exactly how these questions work and exactly what they're trying to teach you with these questions. So without further ado, I really just wanted to start off with a little bit of a sample for the audience. I will share my screen and show you a little bit of what our lecture series is like for this United States Medical Licensing 1, 2, and 3. So I'm going to share my screen here. And it's short. It's not, I can't go into much detail here. Wala, are you able to see my screen here?
Yes.
Oh, excellent. Okay.
Yes, you can see your screen.
Excellent. So this is an example of a slide. So, this is just from histology. So this is USMLE step 1. And what I show is a picture here of adipocytes, fat cells. Now you look at the slide. So I'm not here to teach all the details about, this is not a histology course. Here we focus on getting the question right on the exam, period. So we look at the two pictures, and the one question sometimes they would ask you is they put a picture to this slide here, and they said, under what microscope are you seeing this? Choice A, light microscopy. Choice B, electron microscopy. Choice C, freeze fracture. This is light microscopy. As you can see, this is from a light microscopy. They do the same thing with this picture. Under what microscope are you looking at it? The answer is electron microscopy because it's black and white imaging. This is exactly what we'll teach, how to get that question right. Otherwise, you won't know the answer. You can know all of medicine. You won't know the answer to the question. And another question they ask on this, they show you a picture of this. They put an arrow here, a big arrow here. These are fat cells. And they say, in what patient would you most likely see this type of cell? So choice A, a 29-year-old female with a BMI of 18, a 77-year-old male with a BMI of 31, a 44-year-old male who is an avid runner. So they want you to know that you're looking at adipose cells, so it's most likely to be in somebody with a high BMI.